So we went ahead and we gathered together all of our clients that we work with that use Ascension as, their point of contact, or maybe that's their facility where they work. And we brought them to a roundtable discussion where we talked best practices. So it was really a great opportunity to get different people with different skill sets and different levels of experience within the Ascension system together at the same table to talk how they were troubleshooting and problem solving. We're seeing a lot of providers have to revert back to manual processes. And when you think about when HIPAA and high tech really started to roll out, and the whole goal of HIPAA was to streamline everything, and we've got all of these EMRs in place. Over the last 10 or 15 years, we've become highly dependent on our electronic kind of support processes. And so when that all breaks down, to revert to paper, we have a younger generation in the workforce now that never had to deal with that. So there's just a lot of implications here. And as the systems are starting to, we're hearing them that systems are starting to come back up, they're going to come up gradually. And we know that there's going to be a look back period where the entire health system and all of the providers and the clinicians are going to have to say, wow, how are we going to get all of this information loaded back into our system now, off of paper, off of all of the various means of how people have been compiling this information? It's all got to get back in the system and then build out. So what we're doing at Lighthouse is really, the biggest thing is we need to encourage our clients to have robust compliance plans in place. Downtime protocols it's a new term that I was recently introduced to from one of our colleagues here at Lighthouse, who has a lot of front end experience with these different LIS systems. And I think a lot of times when labs think of downtime protocols, they're thinking of maybe bad weather or something like that. But what happens when your downtime protocols are still relying on the systems that go down? So we're encouraging all of our clients to review their downtime protocols again and really taking this new era into consideration. What happens, not if, but when we are somehow impacted by a cyber attack, whether we ourselves are, what's our risk here, whether our upstream, downstream providers are. It's becoming a really connected universe that we're in, and we need to make sure that we're all kind of looking at the highest level of security we can.